You're listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emron, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you so much for joining me on today's episode of Simple Health Radio. I'm your host, Dr. Emron. On today's episode, I will talk about a case I had just a few days ago. It was a very scary situation, and I'll describe it as it unfolded in the emergency room. It was Sunday evening, around 6 p.m., and I was at my desk doing some charting. One of the nurses came up to me and said, "You have to go to room 2 right away. There's a very sick patient there who can't talk." I said, "Okay, well, let's go take a look." Usually when nurses come up and approach a doctor like that, especially in the ER, that's a sign that there's something bad that could happen or has already happened. I went into the exam room. I saw a woman. She was about 45 years old. She was a Caucasian female. She was there with her husband. I asked the patient what happened, and she could barely speak. Basically, she was drooling from the mouth. She was very sweaty. She looked very ill and anxious, and she was very scared. When I talked to the husband, I asked what had brought them to the emergency department, and so he provided the history. He stated that about a half hour prior to arrival, they were at a restaurant. They were eating dinner. She had just ordered and said she was very, very hungry. The waiter brought out the food. It was a chicken dish of some type. As she was talking to her husband, she took a bite of the food, and then all of a sudden she stopped talking. Now, the husband came over and tried to see what happened, and she wasn't turning blue in the face or vomiting, but she was visibly choking. She was gagging on the food that she had eaten. The patient became very scared, and even though she couldn't speak properly, she told her husband that she wanted to leave the restaurant immediately. He wanted to call the ambulance. She did not want him to do that, and so they drove from the restaurant to my emergency department, basically in a choking sensation the entire way. And that's why the nurses, when they saw this patient walk in, who was not able to speak, who was drooling at the mouth, and they couldn't get a full history, they grabbed me from my desk and told me to go see her immediately. Her blood pressure was elevated. Her heart rate was also elevated. However, her oxygen level was 100%. That was a very good thing for me because I could already rule out some of the serious problems that could have happened and led to a very serious situation, including death, right there in front of me before I even had a chance to do my workup. Basically, I felt that the patient had swallowed the meat, the chicken, in a very large bite. And because it was going down the throat and she was talking at the same time, it caused sort of a mismatch. The food lodged in the esophagus, which is the swallowing tube that connects from the mouth to the stomach. The esophagus is about 12 inches long, and it's flexible but not perfect, meaning there are areas that are narrow and then areas that will be a little bit wider. The muscles that line the esophagus are called smooth muscles. What that means is when you eat and you swallow, the body takes over and just pushes it all the way down. Normally, it's automatic. So for most people, when they chew, when they eat, when they swallow, they don't have any issues. However, when you disrupt the natural portion of the swallowing by laughing, talking, being distracted, or by getting any other medical issues involved with it, then you have a problem. In this particular case, I believe the bite of the chicken that she took, it was her very first bite, it was just not chewed properly, and because it tasted so good, she swallowed it almost whole. The upper part of the esophagus, I believe it crossed, but then the narrow portion is where it lodged, and she was pointing to the area of the pain on her throat. So it was very clear that she knew what was going on, and as I said, it was not in the airway, which is called the trachea. That would have been life-threatening in the restaurant. She never would have made it out of the building because if the airway was obstructed, she would have been blue in the face. She would not have been able to speak or cough, and she would have no way to really communicate with her husband or anyone else as to what happened. Now, the difference in those situations, when something is lodged in the airway or the trachea, the Heimlich maneuver can be used to immediately dislodge whatever is stuck there. This is a very easy procedure. There are so many YouTube videos. There's a lot of resources where people are trained now in daycare centers, elementary schools, sports fields. Many places will offer training for free. I strongly advise all of my listeners to at least look at one of the videos, know how to do the Heimlich maneuver. There are two ways. One is where a person would stand behind you and basically do a thrust with their fist into the upper part of the abdomen to push air into the lungs and then hopefully force out whatever food is caught there. The other way is if you're alone, meaning there's nobody with you at that time, or you might be with a small child or someone who simply cannot do the Heimlich maneuver behind you. In that case, you would have to get a chair and then stand over the chair and basically fall onto the back of the chair, and the same idea, to force enough air up into the chest cavity in order to dislodge whatever may be there. When you see the videos, it makes a lot more sense, and this is a life-saving maneuver. I strongly encourage everyone to be familiar with it. Hopefully you never have to use it, but truly it will save someone who's right there in front of you who is choking and may die otherwise. Now, the situation that we were encountering here is esophageal. So what that means is the food was large enough to get stuck in the esophagus. The patient could not cough it up, she could not throw it up, and she could not swallow it down. So as a medical doctor, what do we do in that situation? So there's a couple of things. The first thing is, as I mentioned, my nurses recognized this was an emergency. They already started everything on autopilot even before I had a chance to talk to the patient's family. They started an IV. They obtained blood samples. They put her on some oxygen just to calm her down. She was already in a gown. They were able to kind of calm her in a way that she could sit upright, still be comfortable, even though she was drooling. The first steps are to get the vital signs rechecked and monitored every few minutes. We have to make sure that the airway stays open. We have to make sure the blood pressure stays normal, and the pulse rate we can monitor. But we have to be sure the patient doesn't pass out. Otherwise, that's going to turn into a very serious issue. The second thing is that we start IV fluids. Now, you would ask, why would you start IV fluids on a patient who is coming in with a choking episode? Well, the IV fluids help us because it keeps the blood pressure normal, and it also allows us to give medication through the IV because I can't give anything by mouth. It's going to be difficult for her to swallow any liquid or pills that would be beneficial. So through the IV, there were 2 medications that I had available in the emergency department, which was very, very fortunate. The first medicine is called glucagon. So glucagon is a chemical. It's actually made in the body, and it raises the blood sugar. That's one of the normal functions of glucagon. However, in this situation, if you give glucagon IV, it's actually a smooth muscle relaxer. So if anyone has ever taken a muscle relaxer for a back injury or a neck injury, you'll know that it actually relaxes the muscles. It reduces that tension. And that's exactly what glucagon is intended to do in this situation. Because, again, the muscles in the esophagus, that swallowing tube, they're not able to push down that food. It's so tense, it has nowhere to go. If we can relax the esophagus muscles, the food has more space, and it'll simply slide down. That's the idea with the glucagon. The other medication that I had available is called Reglan. So Reglan is also a similar type of medication. It works mostly on the small intestine, but it is a type of muscle relaxer. In this situation, since I had both available and the patient looked very, very sick, I went ahead and gave both medications. I stayed in the exam room with the patient. I talked to the family. I tried to allay their fears. I explained everything that we were doing because the other thing as a doctor or as a nurse or any professional in the ER, you have to maintain calm. If the doctor gets nervous, if the nurses get nervous, the patient is going to get very, very nervous, and that's not good for anybody. So we do our best to keep everything in a controlled environment. I reassured the patient everything is going to be okay. I encouraged her to tell us if she had any pain, if she felt like she was going to pass out, or if she had any issues. She was just very anxious, and rightfully so. After about 15 minutes, both medications being given, she was a little more relaxed. She felt like something was moving in her throat, but she couldn't really describe what she felt because she couldn't talk to us properly. So I advised the nurses to get a Coca-Cola, just a little can of soda, from our refrigerator. I handed the patient the Coca-Cola, and I said, why don't you take a few sips? She was very nervous. She did not want to take a sip of that, but I said, it's okay. We are all right here in front of you. Go ahead and take a few sips, and let's see what happens. She took one sip, and she felt like she was going to throw up. She did not want to continue. I said, that's okay. Let's give it a minute or so. She calmed down. She took one more sip. She burped a little bit, and the food dislodged. And it dropped straight from the esophagus down into the stomach right in front of us in a matter of just a few seconds. And the relief on that woman's face, I will never forget it. She smiled immediately afterwards, and then she was able to speak, and she said, I'm never eating chicken again. And then everyone laughed at that point. So it was kind of a comical situation. You had to be there to see how much tension there was just before that, and then how relieved she was immediately thereafter. And then I could properly talk to the patient. So she told me that, yes, indeed, she had tried to eat the food. It was kind of a big bite. And then she said that she had a history of something similar that happened about 10 years ago. But at that time, she was able to manage it on her own. In this case, it was just too much. And she was glad that her husband brought her to the ER. I still told them they probably should have called an ambulance just to be on the safe side, but I didn't fault them for coming in. We monitored her for another 15 or 20 minutes. She felt great, and we sent her home. Now, in this case, it worked out well because it was during a time where I was available, the nurses were available, all the medications were available, and the effect was there. So the muscles were smoothed out, they were relaxed, the food dropped, and she had no issues thereafter. If it did not happen in that such a smooth way, then we have an issue. Then those people have to be admitted to the hospital for an emergency procedure. We call that endoscopy. So endoscopy is basically a camera test. So a GI doctor, which is a stomach specialist, put the patient under some anesthesia. They'll introduce a very flexible, almost looks like a garden hose with a little camera on the end of it. It goes down the throat. They visualize where the problem is in the esophagus, and they either push it down or they grab it with the little sort of pliers, and then they use the forceps or those pliers to remove it upwards. So endoscopy is an invasive procedure. It's the only way to dislodge something that's stuck in the esophagus. And that's not a procedure that's commonly done in the ER. Those people would have to be admitted into the hospital. They would have to go to the operating room or to a surgical suite and then go through that procedure. So fortunately, this patient was able to avoid that. But in other cases, you may find that this situation may not improve. Even with our medication, even with monitoring, even with everything that we do, she would have to be admitted and then go to surgery. Now, the Coca-Cola method that I described is something you can try at home if it's a mild situation. So I don't encourage this if the person looks very, very sick, if they don't have all the availability of medical staff or nurses or other people around them, because you don't want to swallow the Coca-Cola or any other object into the lungs. That will lead to a very serious infection. So this was done under a controlled setting. I highly encourage people who may be in this situation, just go to your nearest ER or urgent care. Tell them what's going on, allow them to do their testing, allow them to give you some medication, and I promise it will improve after that. If not, then definitely a GI specialist would be involved, and endoscopy would be the next treatment. So I hope you enjoyed today's episode about this topic, which was a food particle that was lodged in the esophagus. Learn the Heimlich maneuver. I strongly encourage all my listeners to do that. Send us any feedback. If you've had a situation like this happen to you or someone that you know, do you have other tips or tricks, something you could try before you go to the ER that has worked for you? I'll be happy to share it with all of my followers. We have a very active social media profile, and I look forward to having you back on a future episode. Thank you.
We hope you enjoyed this week's episode. Visit simplehealthradio.com to read the blog, follow links mentioned on this episode, and easily share content with your family and friends. Subscribe to the show on iTunes, Spotify, YouTube, Spreaker, iHeartRadio, and the 3 and Out Radio Network. Be sure to connect with Dr. Emron on Twitter, Facebook, Instagram, Pinterest, and Tumblr to send us your questions and ideas.